October is Breast Cancer Awareness Month. 1 in 8 women in the U.S. will be diagnosed with breast cancer in her lifetime, according to the Center for Disease Control and Prevention. And DC News Now's anchor Chris Flanagan spoke with a breast cancer doctor at the George Washington University Medical Center. Their conversation is what's going around.
Dr. Brem, how do you know if you're at risk for breast cancer?
That is a great question. And it's interesting, very important to note that 3/4 of women who have breast cancer have no other risk factor except being a woman. So most women who have breast cancer, develop breast cancer, really the #1 risk factor is being a woman. But some of the other ways you might know if you're at increased risk is if you have a family history of breast cancer, particularly if you have multiple members of your family who have breast cancer either in both breasts or early. And some families just don't have a lot of women in their family. And if that's the case, then you might have men in your family who have young or many men with prostate cancer that can be associated. So those are the kind of things we look for with familial breast cancer, genetic breast cancer. And it's important to note that there have already been 70 genes that have been associated with a substantially increased risk of breast cancer. And you can get those genes from either your mother or your father equally.
So at what age should a woman start screening for breast cancer?
Regardless of all the different recommendations, it is critical in order to achieve the outstanding 40% reduction in the death rate from breast cancer that we've seen over the past 2 decades. Every woman has to get her mammogram starting at the age of 40 and every year until her life expectancy is 5 years or less. Unless she has a family member with breast cancer, then they should start 5 to 10 years earlier than the age of the relative. And if you have dense breast, mammography alone is not enough. You must get an ultrasound or additional imaging. And if you do have this gene or multiple family members with breast cancer, then an MRI every year is appropriate as well.
Dr. Brem, are there ways to reduce your risk of breast cancer?
You know, we can't prevent breast cancer. There's nothing we can do that will assure that we won't develop breast cancer, but you can reduce your risk. First of all, you can live a healthy lifestyle, proper weight, exercise, proper diet, limit alcohol, limit processed food. And you can certainly live in areas of the country that have a lower risk of breast cancer, but we can't prevent breast cancer. And we also are born with intrinsic risks of breast cancer based on our family history and our genetics, which of course we can't change as well.
Dr. Brem, terrific information. We really appreciate it, and so important, especially now during October, which is Breast Cancer Awareness Month. Thank you for joining us.
Thank you very much.